What is proton beam therapy? Proton beam therapy is a type of radiotherapy, and it's a type that uses particles, subatomic particles, called protons. So some radiotherapies use X-rays, also called gamma rays. Other radiotherapies are particle-based. Proton beam therapy itself is actually quite an old technology, several decades old, but it's only been widely used with CT scanners and PET scan machines now. There are some benefits of using particles compared to using waves like X-rays. So proton beam therapy uses particles, these protons, which are one of the two particles in the nucleus of an atom. And these protons are fired out by the proton beam device. And the beam of particles has quite strange properties when compared to like a standard X-ray based radiotherapy. So with a standard X-ray, the intensity of the beam drops rapidly from the device, like with distance from the device. If it was going through a vacuum, it would be the inverse square law. So when you double the distance, you'd only have 25% of the intensity. That causes problems with targeting cancer tumours that are inside the body. So, first of all, if you think of a cancerous tumour on the outside of the body, so skin cancer on the skin, you aim the beam at the tumour, the cancerous mole or whatever it is on someone's body, and the maximum intensity is pretty close to where the tumour is, and it's good. If the tumour is inside the body, as the distance is increasing, the intensity of the beam drops very significantly. So to get enough intensity at the point of the tumour, you need to start with a lot of power, and that's going to cause damage to healthy tissue, because for the beam to get through the tumour, it's going to pass through the skin, maybe a bit of organ tissue or bone, depending on how good the pathway is to the tumour. So you can imagine in some parts of the body it's just too dangerous to do. Now there are things you can do with gamma ray or X-ray based therapy to improve this. You can do a thing called beam shaping or beam forming. You can use many low intensity beams focused on a point, but you still have essentially you're struggling against this problem of the maximum intensity of the beam is in the wrong place. With proton beam therapy and other particle therapies, the beam doesn't start, it's almost like the beam is not starting at the device. It really is, but I think it's like the particles start interacting with the body tissue a certain distance from the device, and this effect is called the Bragg peak effect, because when you look at a graph, there's this certain peak of intensity, a sort of fixed distance from the device. You can control that distance, and essentially it's like being able to decide where the beam starts. So you can maximize the intensity on the tumour, which is of course great, with minimal damage to the healthy tissue in front of the tumour. Another problem with gamma ray or X-ray radiotherapy is that beam goes on forever. Now it gets much weaker with distance, but technically it goes on forever. So you get sort of like an exit wound almost, with healthy tissue behind the tumor receives radiation as well and gets damaged. But with proton beam therapy or other particle-based therapies, it's as if you can decide where the beam starts, and the nature of the machine allows you to essentially decide where it stops as well. So the intensity drops off very, very rapidly, very suddenly, as the beam is kind of towards the end of the tumor tissue. So what this means to the patient is hopefully a lot less in the way of side effects, because you're damaging healthy tissue much less. You can also have a higher dose because it's more targeted. But another benefit is that if it doesn't work, or if you need repeated treatment, that may still be an option to have more radiotherapy, because you haven't damaged too much healthy tissue. There could still be multiple safe pathways to using the radiotherapy to get the remaining tumor tissue, or if the tumor has kind of grown back after some time. So yeah, this is why proton beam therapy is potentially a very good option for certain patients in certain situations. Currently it's pretty expensive in most countries. It requires huge device, generally building-sized device. So hospitals will have a proton beam therapy treatment center, like a separate building with a big particle accelerator in the basement, and some treatment rooms, and a lot of very, very high-tech equipment. So that's how proton beam therapy works. I've had proton beam therapy, so if you have questions about it, please ask your question below this video and I will reply, and if it's a complex question, I'll make a video for you. Okay, thanks a lot.